Hey everyone, welcome back to the channel. Today, we're diving into a topic many of you asked about. Blood tests affect a huge part of your healthcare journey. It feels like just a quick needle prick. How complicated can it be? The little things you do in the hours before the draw can massively impact results. A clean snapshot means accurate decisions. For senior women, getting this right is crucial. Your blood test is a snapshot of your health. If that snapshot is distorted, it can trigger worry, more tests, even incorrect plans. We want to avoid all of that. I'll walk you through 10 common, easily avoidable mistakes, why food, supplements, and timing matter, so you walk in confident. Give your healthcare team the clearest data possible. Let's get into it. Chapter 2. Fasting too long and dehydration. 16 hours isn't better than 8. Wrong. Prolonged fasting stresses systems and shows up in blood work. It can drop blood sugar, hypoglycemia. It can change kidney markers too. Labs reflect stress, not your baseline. Stick to 8-12 hours and hydrate. Unless told otherwise, sip plain water. Dehydration falsely elevates counts, electrolytes, B-creatinine. Hydration makes the draw easier and less painful. Now the cousin mistake. Not drinking enough water. Low fluid volume flattens veins and slows flow. Clotting or hemolysis can distort potassium and other values. Drink a glass or two about an hour before your draw. If you have fluid limits, follow your doctor's guidance. Don't chug a gallon, just normal intake. Hydration protects sample integrity and accuracy. Simple step, big accuracy gain. Quick tip: for fasting labs, stick to plain water. No lemon, sweeteners, creamers, or gum. Let's move on to mistake number 4, taking biotin right before your blood test. Biotin, or vitamin B7, is incredibly popular for supporting healthy hair, skin, and nails, and it's found in many multivitamins. While beneficial for your beauty routine, it can be a major problem for your lab work. Here's why. Many modern lab tests use a highly specific technology called biotin streptavidin binding to measure substances in your blood. Think of it as a precise lock-and-key system. When you take high-dose biotin supplements, excess biotin floods your bloodstream and essentially gums up the lock, competing with the substance the test is trying to measure. This interference can cause dangerously inaccurate results. It can make your thyroid hormone levels appear falsely high or low, leading to an incorrect diagnosis of hyper or hypothyroidism. Critically, it can create a falsely low result for troponin, a key marker used to diagnose a heart attack. These aren't just theoretical risks. Real-world mix-ups have led to serious misdiagnoses, prompting the FDA to issue official warnings. To be safe, tell your doctor about any biotin you take and stop all supplements containing it for at least 72 hours before your blood draw. Always check the labels. Biotin often hides in B-complex and multivitamin formulas. Mistake number 5 is related, not disclosing everything you take. This goes beyond just biotin. We're talking about all prescription medications, over-the-counter drugs, vitamins, and herbal supplements. Things you might consider harmless can have a significant impact. For example, regularly taking non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen can affect blood flow to the kidneys, potentially elevating creatinine levels and falsely suggesting kidney problems. Corticosteroids, whether in pills or inhalers, can spike your blood glucose and white blood cell count, mimicking diabetes or an infection. Even natural supplements matter. St. John's wort can alter liver enzymes, while ginseng can affect blood sugar and clotting tests. The solution is simple. Keep a detailed, current list. Write down the name, dose, and how often you take each item. Bring this list not just to your doctor, but also to the lab and hand it to the phlebotomist. Providing this context can prevent a cascade of costly, invasive, and stressful follow-up tests that might stem from a simple, explainable lab abnormality. Finally, mistake number 6, drinking alcohol before your lab test. It's best to avoid alcohol for at least 24 to 48 hours before your blood is drawn. When your liver processes alcohol, it can cause a temporary leakage of enzymes like GGT, ALT, and AST into your blood. A spike in these markers can trigger a false alarm for liver damage, leading your doctor to investigate a problem that doesn't exist. Alcohol also raises triglycerides, a type of fat in your blood, which can misrepresent your cardiovascular risk profile. Furthermore, it can cause wild swings in your blood sugar, first spiking it and then causing it to drop, making a fasting glucose reading unreliable. It's also a diuretic, which can cause dehydration and concentrate your blood, skewing other results. Give your body enough time to fully metabolize the alcohol and return to normal. This ensures your results reflect your true baseline health. It's a small adjustment that pays huge dividends in accuracy. Treat your lab appointment with the respect it deserves. Skip happy hour and save the toast for after your test is complete. Pause non-essential vitamins and herbal antioxidants for 24 to 48 hours. Continue prescriptions unless your doctor advises otherwise. Mistake 7. Hard workouts the day of or before your test. While exercise is key to good health, a vigorous session right before a blood draw can trigger a powerful stress response. As your muscles work and repair, they release substances into your bloodstream that can mimic signs of disease. The most common flag is a massive spike in an enzyme called creatine kinase, or CK. This can alarm doctors because high CK is also a marker for muscle damage or even a heart attack. Your white blood cell count might also temporarily rise, and liver enzymes like AST can be elevated. So, treat the 24 hours before your test as a rest day. Avoid heavy lifting, long runs, and intense fitness classes. Gentle walking is fine. The goal is to let your labs reflect your true baseline health, not a temporary workout spike. If you did work out hard by mistake, call your doctor's office. They may advise you to reschedule. Mistake 8. Caffeine or smoking right before your test. That morning coffee or cigarette is a stimulant that can throw your body's chemistry off balance. Caffeine works by triggering an adrenaline surge, which can temporarily raise your heart rate, elevate blood pressure, and even increase blood sugar levels. This could be mistaken for a glucose metabolism issue. Nicotine has a similar effect, constricting blood vessels and making your heart work harder. Furthermore, carbon monoxide from smoking binds to your red blood cells, reducing their ability to carry oxygen, a value doctors sometimes measure. To get an accurate reading, you need to be in a true resting state. Skip all sources of caffeine, coffee, tea, and sodas, for at least 8 hours before your draw. Avoid smoking for at least an hour. Have that coffee or cigarette as a reward your appointment. We're measuring your resting physiology, not a stimulated state. Mistake 9. Getting your blood drawn at the wrong time of day or timing your medications incorrectly. Many substances in your blood follow a natural 24-hour cycle or circadian rhythm. Testing at the wrong time can give a misleading picture. A key example is cortisol, the stress hormone. It naturally peaks around 8 a.m. and falls throughout the day. An afternoon draw would show a low level, which is normal for that time but could be misinterpreted. Other hormones like testosterone and TSH also fluctuate. Medication timing is just as critical. Your doctor may need to know the trough level, the lowest concentration right before your next dose, or the peak level, the highest concentration after you take it. Always ask if they need a peak or trough draw. If you're ever unsure about timing for a test or a medication, a quick call to your doctor's office will provide the clarity you need. Arrive 10-15 minutes early to sit quietly. Resting lowers stress markers for cleaner results. During the draw, avoid clenching or pumping your fist. Keep the arm relaxed to prevent false potassium elevations. Mistake 10. Arriving without ID or a current med list. At every lab visit, you'll need to present a valid government-issued photo ID, like a driver's license or passport, along with your current insurance card. This isn't just a formality. Strict identity verification is a critical safety measure. It ensures your samples are labeled correctly and your results are linked exclusively to your medical record, protecting your privacy and preventing dangerous errors. Equally important is a comprehensive, up-to-date list of everything you take. Your doctor and the lab use this list to interpret your results in context. For example, common cholesterol medications can slightly elevate liver enzymes. Diuretics can alter your potassium levels. And even a supplement like biotin can interfere with tests for thyroid function. Without this information, a normal medication-related change could be mistaken for a new health problem. Your list should be exhaustive. Include all prescriptions with their dosages, any over-the-counter medicines like pain relievers or allergy pills, and all vitamins, supplements, and herbal remedies. No detail is too small. To make this all easier, let's run through a quick pre-lab day checklist. The night before, confirm your fasting instructions. Review your medications and check with your doctor if you're unsure about taking any morning doses. Plan to drink plenty of water, and finally, gather your paperwork, your ID, insurance card, and your completed medication list. Place them somewhere you won't forget. Now, let's address a few common questions. What if I'm diabetic and need to fast? Your health is the priority. Never adjust your insulin or diabetes medication on your own. Call your doctor's office for specific instructions on how to manage your blood sugar safely. I'm on a blood thinner. Is that a problem? It's not a problem, but it is crucial information. Tell the phlebotomist before they begin. They will know to apply firm pressure to the site for a little longer afterward to prevent bruising. Can I take my morning pills with water? In most cases, taking medication with a small amount of plain water is perfectly fine, even when fasting. However, it's always best to confirm this with your provider. So there you have it. 10 common yet preventable mistakes. As we've seen, it all boils down to a partnership between you and your healthcare team, built on clear communication and thoughtful preparation. By following these simple guidelines, you're providing the most accurate, reliable data possible. This empowers your doctor to make the best decisions for your treatment and wellness plan with confidence. Think of every lab test as a valuable snapshot of your health. It's a powerful tool for prevention, allowing you to catch potential issues early and monitor ongoing conditions. Don't let a simple, avoidable error cloud that picture and create unnecessary worry. A little planning goes a long way in ensuring clarity and peace of mind. True proactive healthcare begins before you even walk into the lab. The power to ensure accuracy is truly in your hands. If this guide was helpful, please give this video a thumbs up. It helps others find this important information. And consider sharing it with a friend or family member who might have an upcoming lab test. We'd love to hear from you in the comments. Have you ever had a confusing lab result that might have been caused by one of these mistakes? Sharing your experience could help someone else in our community. Thanks for watching. We're here to help you feel more confident and in control of your health. Take good care of yourselves. We'll see you in the next video. Before you go, double-check your lab order or portal for any test-specific preparation instructions.